Hi everyone, I am Dr. Ang Chia Liang. In this video, we will show you the injection technique for Synvisc-One. We will show you the equipment that you need to be able to perform a Synvisc injection in your clinic. Starting from the top row, this top row shows you the equipment that you need to clean the patient. From this side, this is a waterproof sheet, chlorhexidine wash, gauze, non-sterile gloves and sterile gloves. Coming to the bottom row, these are the equipment that you need to do the injection. Lignocaine 1%, about 5 ml will be enough. A 5 ml syringe, a 23G blue needle. For the injection itself, a 21G green needle, Synvisc. And for dressing after the injection, a Primavor. First, let the patient lie down on the couch and put the waterproof sheet below the knee. Couple of things to note: let the patient lie more towards the edge of the couch so that when your hand is here performing the injection, there's room for your hand to maneuver. Second thing is that when patients lie down normally, usually their knee is externally rotated. So to help with this, you can put a blanket below the patient's buttock. Okay? And ask the patient to relax. And now you will see that the knee is straight, the patella is pointing straight to the ceiling, and that's the position that we want. Landmarking. For the superior lateral approach to the knee, you want to be able to landmark the patella properly. Have a feel of the patella. Usually you can catch it between your thumb and the index finger and rock it like this. Surface mark the patella. There it is. The entry point is about 1 centimeters off the superior lateral corner of the patella. This is the corner, so the entry point is here, within this circle. You will be able to feel a depression here, which is between the patella and the femoral bone. We'll show you the cleaning now. Now it's important to do a Synvisc injection in a clean way, but by and large it's okay to start cleaning with non-sterile gloves, as long as the cleaning process is rigorous and you make sure you do not contaminate it when you do the actual injection. To clean, you can use the gauze, pour a little bit of chlorhexidine, and you can clean it over the knee in a circular manner like this. Make sure you clean over a wide area. Now you can actually use a marker to surface mark like what I did. Just make sure you clean it well, clean it wide, and then let it air dry. So during this time, while you're letting it dry, your assistant will be helping you draw the lignocaine. Now, at this time too, you will have changed into sterile gloves. So now with sterile gloves and the lignocaine in your hand, you can start to approach the knee. So now we will inject the LA first. So coming back to the knee again, and that's the patella. I'm holding it between my thumb and the index finger, and I feel a shallow space right here that's between the patella and the femur bone. So you will do the LA injection in exactly the same direction that you would do the actual Synvisc. The important thing about LA is that you should infiltrate it to the skin and some of the sub-Q tissues. Try not to infiltrate a lot of LA into the joint. So this is the entry point at that depression, and you're aiming inferiorly. You're aiming downwards, not horizontally like this, but downwards like this. So after you have infiltrated LA into the skin, then you can switch to the Synvisc using a green needle. Okay, we've let the LA work for about 1 minute or so, and so now I'm holding the Synvisc in my hand. Let's just assume this is Synvisc. Use a green needle. As Synvisc-One is quite viscid, you may find a lot of resistance if you use a blue needle. So in exactly the same direction that you have done just now, put the needle in. What you want to aim for is to have the needle tip end up beneath the patellar bone. So almost the whole length of the green needle should be able to go into the knee, and that will tell you that you're in the right direction. If you hit bone, then what you should do is you should back out the needle, re-angle it in another direction, and then go in again. Okay, now we switch to the model view, and this model is to show you where the needle should end up. So this is the lateral view of the right knee, and this is the patella and the femur bone. So the depression that we feel is usually here. So your needle will have come in here, and you will want to end up with the needle tip beneath the patellar bone, like that. Like that. In this part, I will demonstrate the technique with the patient seated. So sometimes we'll do it with the patient seated like this. If the patient has a very tight patella, if you feel that it's difficult to get the space beneath the patella. So we'll do it with the patient seated. The knee is bent at 90 degrees. Same thing, you will start with surface marking the patella. For this technique, which we call the anterolateral technique, you need to surface mark the patellar tendon, which is here. The entry point of the needle is at this shallow space that is just on the lateral side of the tendon, just at the inferior border of the patella, within this space. So same thing, after cleaning the knee and letting it air dry, you will inject the anesthetic first, followed by the Synvisc. The point of entry is in this shallow here, and you will be directing your needle towards the middle of the knee. When we do a scope, this is exactly the same entry point that we use to put in our scope. We're actually aiming for the trochlear, which is in the middle of the knee. And usually you can put it horizontal to the floor. It should be able to go in to the knee. Okay, after the injection is done, then you can dress it using this. Just a small piece of gauze cut in a small square like that, and the Primapore. So this is how I do it, and I think it helps to give the wound a bit of pressure. Place the gauze there. Put the Primapore down one side first, and make sure you stretch it over so that there is some pressure over the injection site. And the patient can take this off in the evening when they shower.